Let's biopsy some breast calcifications, or as we call it in the biz, stereotactic core biopsy. So stereotactic core biopsy is done under a mammogram, and they can either be performed sitting up like this table, or you can be laying down on your belly with your breast hanging through a hole and the radiologist working underneath you. I much prefer the upright stereo one for obvious reasons, but either is fine. So first, my amazing mammography technologist, Diane, who also had breast cancer, will position her breast so I could find the calcifications. Once I identify them and pick my target, the fancy mammography software will tell me exactly where in the breast calcifications are located. Also, we're taking a few mammography pictures along the way to make sure the calcifications are not moving around. Once I find my target, I numb the skin and the breast using lidocaine. It feels like a pinch and a burn, and then after that, you really should only feel pressure. If you feel anything sharp or painful, please tell the doctor. It should not be painful. Just ask for more lidocaine. Once you're all numb, I make a tiny little nick and place my biopsy needle. It's a 9-gauge needle, which means nothing to you, but again, you should only really feel pressure. Once I'm in position, I take my sample. We actually x-ray the tissue with every single sample, so we know when we got the calcifications. I love this machine. Shout out Brevera. Once we have adequate samples, we always place a biopsy clip to document the area in the breast that was biopsied in case it needs to come out. After we're done, we hold compression for about 10 minutes, and then we get post-biopsy mammogram images, document where the clip is. We don't press as hard because we know you're sore. After the biopsy, you're going to want to wear a tight sports bra to minimize the bleeding, or we'll wrap you up in an ACE bandage. You might feel sore for the next few hours, but we tell you to take some Tylenol if you're having any mild pain. But most people say it's not that bad. We get results in about 3 to 5 business days later. About 80% of biopsies are benign. But unfortunately, this came back as DCIS, which is the earliest form of cancer, which usually presents as calcifications. This is why mammography is so important. Thankfully, it was caught early because early detection is the breast protection. I hope that was helpful. As always, follow the Boopy Docs for more of the breast information.